Welcome back to Jersey Matters. I'm Larry Mendte. In our last segment, you heard from Randy Chen, a Jersey man who says he was suffering severe symptoms from COVID-19 when the drug hydroxychloroquine saved his life. So why isn't it available to everyone? That's what Morris County Republican State Senator Joe Pennacchio wants to know. Senator, thank you so much for doing this. Let me first ask, how are you and your family doing through this? All right?
Doing well as me asking you and all your listening audience and viewing audience. Hopefully everybody's isolated and safe.
You're in Morris County. Morris County, a lot of North Jersey, has been hit hard. I see you quite often. I think all you have to do is Google coronavirus or COVID-19 in New Jersey, and stories about you pop up as well. You have been somewhat critical of the governor. What is your problem with how he's handling this?
Well, it didn't start off that way, and I'm more critical of the administrative policy. Don't forget, he depends on people at the State Board of Health to give him direction of what he should and shouldn't do. But quite frankly, the State Board of Health is hiding behind the skirts of the FDA. They're punting. There's things that I feel that they should be doing, and the I is in consultation with other healthcare professionals. We have over 100 people that have signed on and said, unshackle the doctors, give them the ability to treat their patients. The best you can say about Governor Murphy at this point is that he's just better than Governor Cuomo when it comes to the use of the hydroxychloroquine in the treatment, and we would hope eventually the early preventive treatment of COVID-19.
That's specifically, you've had a couple of criticisms, but specifically now your criticism is hydroxychloroquine. To explain what that is and why you think it should be used.
Well, I'm sure by now a lot of people have heard hydroxychloroquine, HCQ. Either it's used in conjunction with the Z-Pak, azithromycin. Some have used it with also zinc. These protocols are worldwide. I think over 70% of doctors in Spain use it. It's part of the protocol in countries like China and South Korea and Australia. Countries like India and the United Kingdom, they have banned the export of this drug. It's a very cheap, inexpensive drug that's been around for 70 years. The risks are minimal. It still has to be prescribed by a doctor, and the doctor will go over your health history to make sure that you can take it, but with very, very few side effects. And the point is this: we don't have any other choices. This is what we have right now. These are the tools that God gave us to fight this pandemic. We should be using them.
I read today that that Governor Cuomo is allowing some testing of HCQ in New York. I know Penn University is going to test it right now, and because that has been the problem. They don't feel like there's enough tests. Dr. Fauci said about HCQ, all of the testing has really been anecdotal, and I can't say definitively that it will work. What do you say to that?
Why does it matter that he has to say definitively? What is the alternative that he is giving us? Everybody agrees that we should have a whole-scale, double-blind, placebo, randomized study. Everybody agrees with that. But people are dying. So you'd rather have your scientific protocol done first before you put the lives of the people that are dying ahead of that. You can do both. You can do both at the same time. And at one point, that's to stop being anecdotal. You had this French doctor, Dr. Renault, who initially brought it to the world's attention. He had a small sample of about 30 patients, not big enough. Then he had a sample of 80 patients, still found great results, not big enough. My understanding now he's going to come out with the results of about 1,000 patients that checked through the French hospital system. They're still going to say it's not enough, it's not big enough, it didn't go through the clinical trials. So these are the tools that we have. This is the army that we have. This is the war that we're presented with. We have to go to this war with the army that we have. And right now it's hydroxychloroquine. When you treat the disease with the hydroxychloroquine, you decrease the viral load. That's the amount of viruses that are inside you. Why is that important? Because first of all, that's what's getting you sick, but also as important, that viral load is what you are shedding. It is that shedding that helps you communicate this disease with other people. So if we're able to get that shedding down, we're able to stop that communication. You stop that communication, there's no difference between doing that or as an adjunct with isolation. So we can actually break ourselves out of this pandemic, and we can actually decrease our isolation if we make this part of the protocol in the future of the treatment of COVID-19.
What would you like the governor to do right now? What have you been asking him to do?
Well, minimally, you got to stockpile the drug, and you have to develop a protocol on the distribution. What do I mean by that? There's certain people that need this drug that are on lupus, that are on rheumatoid arthritis. We got to make sure that they have the drug. Then you have to divide the people as far as the severity of the disease and how they're exposed. Certainly you want first responders. If you're going to use it as a preventive measure, you want them to have it. You want those people in the hospital, the doctors and nurses that are being inundated with these key people, you want them to have it. And then you also want people that are keeping us alive, that are keeping our sanity, the store workers, the delivery people. And not only them, but also their families, because if they're exposed to this, eventually they're going to shed those viruses onto their families. So this is the protocol that the state should have developed. We were in touch with them almost a month ago, and sadly, to my knowledge, they have not.
It is being pushed heavily. He called it a possible miracle drug by President Donald Trump, and he has been receiving criticism for having the same position that you have. Do you believe that one of the reasons that Governor Murphy doesn't want to go through with HCQ and why others may be coming back at you is political?
No, absolutely not. Because Governor Murphy has family and loved ones, and I truly do think that he loves and respects the people that he serves. I think, again, it's more of a paralysis of bureaucracy. Every group and every level of bureaucracy is telling them to do something, and they all just stop. No free thought is allowed in the bureaucracy. You basically subordinate yourself to the level above you. So the Department of Health, they're taking their marching orders from the FDA and CDC. Now, keep in mind, this is the same group that a month ago was telling you don't bother wearing masks. Now they're telling you to
investigative piece now, I guess just out today, saying that Donald Trump, they believe, is linked to, would gain financially from HCQ.
That's evil, Larry. That's evil at work, and I'll tell you why. You've seen all these groups of pharmacists. They're donating almost 200 million pills. Okay, the pill only costs between 5 and 10 cents to produce, and they're giving it away for nothing. They wouldn't be giving it away for nothing if they didn't think it worked. And the real money to be had is with all these new antiviral treatments. Those are the ones that cost an awful lot of money. So you have an inexpensive drug. You have a drug that's been out there for 70 years, working in combination with even a Z-Pack, who's also now is off the copyright time. All these things are all very, very positive. Why are they not allowing doctors to use it?
Senator Joe Pennacchio, Morris County, always a pleasure to talk to you. Thanks for spending the time, and I hope you and your family stay safe.
And likewise to you as well, and thank you for taking interest in this story.
That was State Senator Joe Pennacchio. When we come right back, a lot of people are working from home, and that raises new cybersecurity risks. We'll talk about it when Jersey Matters continues.